Good afternoon, everyone. I'm Mary Rice. I'm the director of the Center for Climate, Health, and the Global Environment at the Harvard Chance School of Public Health, and I'm a pulmonologist at Beth Israel Deaconess Medical Center. And I will be moderating today's discussion on heat resilience and promoting health in cities. And I'm really honored to be joined by an incredible group of panelists, each of whom has experience addressing the health consequences of urban heat through policy, through healthcare, and through research. We have with us today two leaders from the Boston area who are working directly with impacted communities on innovative solutions to protect public health and improve climate resilience. And they are Flor Amaya, Director of Public Health for Chelsea, Massachusetts. Welcome, Chelsea. Welcome, Flor. And Zoe Davis, who is the Climate Resilience Project Manager at Climate Ready Boston. We also have a leader from Jacksonville, Florida, who launched the city's first ever 50-year climate resilience strategy plan, Anne Covilanisi, Chief Resilience Officer in Jacksonville, Florida. And we have two Harvard faculty members among us today who are working in clinical and research settings to improve health and health equity during extreme heat events. They are Caleb Dresser, emergency physician at Beth Israel Deaconess Medical Center and core faculty at Sea Change, who's working, among other projects, on research to distribute air conditioners to high-risk adults in the Boston area. And Dr. Amruta Nori-Sarma, assistant professor of environmental health at the Harvard Chance School of Public Health and deputy director of Sea Change, who is doing work on heat impact and health of communities in the Mystic River watershed. So my first question to this group of panelists is, what solutions have worked well in your cities as you try to improve heat resilience and public health? And I'll start with you, Zoe.
Oh, wow. Okay.
Hi, everyone. So that's a great question. Over the past 3 years since we have released the HEAT plan in 2022, there have been a few flagship programs that we've launched. One I'll mention is our distribution of ACs and fans. This was particularly during the pandemic and just coming out of quarantine, where we saw that there was a huge need for access to cooling indoors because it wasn't safe to be together, both outside and inside. And so folks weren't able to go outside to the places that they would normally go to stay cool. So that was one of our programs. We have, in all honesty, not continued that program. There's still a bit of an evaluation process going to better understand how we can connect the long-term momentum towards our carbon mitigation goals alongside some of that immediate relief and resilience work with ACs and fans. Other programs include tactical urbanism programs, one of which continues to this day, our outdoor cool spaces program. So we did this also, we launched this just at the end of quarantine, where it was safe to be outside together but not safe inside. And so we wanted to create these outdoor living spaces where people could work and play and access shade and misting features alongside other community and city services. So I think those are the two that I would highlight.
Thank you. Flora, I'd love to hear about your experiences in Chelsea.
Yeah, so in Chelsea, I think we followed a very similar approach as Boston, looking at both like long-term infrastructure adaptations as well as short-term heat mitigation initiatives. So our long-term efforts have focused on increasing trees. So Chelsea, if some of you are not familiar with it, is just north of Boston and primarily immigrant community, underserved, and I believe the federal requirement for tree canopy is 20%. The city of Chelsea is just 2%. A tree canopy. And so one of our immediate long-term infrastructure efforts has been how do we increase and plant more trees? Additionally, we have a really strong community-based organization called Green Roots, and their whole work is around environmental justice. In 2021, Green Roots partnered with researchers at BU School of Public Health, and they launched the Sea Heat Study. From that study, not only were we able to assess land surface heat temperature, but also developed a pilot program called a Cool Block, where it's used sort of like this incubator space where we trial different cooling strategies. So within that space, we have now done resurfacing of the streets to lighter colors. We have also done cool roofs, so painting the roofs white. And based on that project, we have now extended some of the cool roofs to other major buildings in the city, one of them being the Boys and Girls Club, and the other that we did this year in elderly affordable housing building. And so I think those have been our infrastructure adaptations. And complementing those infrastructure adaptations, the Public Health Department has also launched an AC lottery program, as well as a Beat the Heat campaign, which provides education to residents how to stay safe, and also where to find cooling spaces like splash pads. And I think by being able to combine both long-term adaptations as well as short-term initiatives to provide residents with some relief in the now, we're able to kind of support their needs now while also building a more resilient infrastructure for the city of Chelsea.
Thank you, Flor. I'd like to turn it over to Anne next. Anne, your work in Jacksonville, Florida is a little different because you're thinking about large systems, transportation, housing, the grid, and how they're impacted by heat. And could you speak to us about how heat creates multi-level challenges and how cities like Jacksonville can prepare?
Yeah, well, first of all, thank you for having me here. I happened to be here yesterday for a heat simulation exercise with a bunch of other cities. And on a personal note, I grew up in Arlington, so it's always great to be back in the Boston area, especially this time of year. We are still in the height of heat season down in Florida, so this is a breath of fresh air, literally. Jacksonville is kind of looking at heat in three main buckets, and some of them mirror things that you've already heard. We're looking at long-term land use change. We're doing an urban forest management plan. We're focusing on increasing shade and misting in our parks and public spaces. But during a heat wave, nobody is leaving the air conditioning and going and standing under a tree. So we're recognizing that is just trying to keep pace with the slow encroachment of hotter summers. But nonetheless, that's really an important pillar of our program. Right now, when we have a heat event, our focus, like many other cities, is on public health. So we're opening cooling centers, we're looking after our unhoused population, we're distributing bottled water, the kind of baseline. And I think that's good. And I think we also know that there's room for improvement there. And we're interested in kind of how do we make sure people, especially those who are economically vulnerable, are able to access heat and turn on their air conditioning. But also, we're not Boston. We have a lot of central air. Most homes have that in Florida. So we're starting from a slightly different level in terms of making sure people have access to cooling. I think the third bucket or pillar of our heat program is really where we're playing a bit more of a leadership role and where we're trying to examine some questions that I think haven't had operational consistency across cities. So when we have a heat wave, well, actually, let me take a step back. When we have a hurricane in Florida, our Emergency Operations Center, our EOCs, they activate, and there is this very sophisticated choreography of communication between the city, our emergency responders, our fire department, our police department, our hospital system, our energy utility, our universities, making sure that students in dorms are taken care of. Across the board, and volunteer organizations, it's dynamic and it's swift. And for temperature events, we have nothing like that. Again, we open cooling centers. And I think where Jacksonville is really interested in is kind of like, where do we have infrastructure vulnerability due to heat? So we were able to get a $1 million grant through FEMA. We still have it. We're proceeding with establishing some temperature thresholds. What temperature does it have to be and for how long before we start to see systems failing? I have 1,100 bridges in Jacksonville, and I know how every single one of them will perform if there's a hurricane, if there's a high wind event or a flood event. I don't know how they'll perform under sustained heat. I don't know what materials and what era of design is more vulnerable, but I don't want to wait until we have a bridge failure. I don't want to wait until we have issues with our tarmac at our airport from sustained heat before we start to think about that. And I don't want to wait until our grid has some failure points. So we're working with a team of experts to kind of figure out what forecast air temperature can lead to kind of these surface and material compromises of our infrastructure. And so at the end of this project, we're hoping we're not only in a better position as Jacksonville, but then there's thresholds that we're able to share with our peer cities and our colleagues.
Talking about systems, Caleb, you are the physician on the panel, and you've done work through Sea Change on how healthcare systems can prepare for climate threats, including extreme heat. Anything you'd like to comment on there from the healthcare side?
Yeah, absolutely. Good to see you all, and thanks for taking time out of your afternoon to talk about this. I work as an emergency doc downtown at one of our major teaching hospitals, and I really came at this issue because I was shocked during residency at how much heat stroke I was treating in New England. Some of that was road races where we sort of expect to see that. Some of that was people who showed up to work and by evening were intubated in the ICU. Some of that was people who developed heat exhaustion at home because their air conditioner broke and they couldn't get it replaced. And so as I got interested in the impacts of climate change, this was a surprising dimension I had not expected as a clinician when I first started engaging with this. And the deeper I have dug on this, the more I start getting interested in these system-level issues. Is there power to run air conditioning, right? That's a huge vulnerability if power grids go down. Is there power to run our ice machine at the hospital? Do we have enough ice? For anyone who has not been involved in the resuscitation of a heat stroke patient, this involves physically immersing people in ice water, which involves a big team of people. It's wet, it's messy. And for people with, for example, heat exhaustion and renal failure, you're talking about a multi-day hospitalization. And so these are big events in people's lives, and they're also resource intensive and they're expensive. And so as we think about those impacts in the acute care system, we have to make sure acute care can do what it needs to do, recognize, treat, and safely discharge. But we also have to make sure we're preventing these because the scale at which heat is impacting health is increasing unsustainably, right? Our healthcare system will not have the capacity to deal with this if you trace these curves out forwards in time. And so we need these approaches that keep people safe at home. One of the studies we're working on at the public health school right now with Mary and a number of others is looking at air conditioner distribution to try and understand how does that affect healthcare utilization, self-reported health metrics, both physical and psychological, and also how are people using air conditioners, right? Because it also costs money to run your air conditioning. Does supplementing a little bit of money to pay for electricity help people use it? How many hours a day will people run it? And that's something we're studying with a stepped wedge trial in Boston right now. We have second season interviews going right now. It's also something I've been informally asking people about in my clinical practice over the years. And you get all kinds of interesting answers, right? I don't run my air conditioning because it smells bad. I don't run it when I'm sleeping because it's too loud. And so this is a big picture systems issue we need to talk about. And it's also a really pragmatic human factors issue that we have to do at the same time. I'll pause there.
Thank you, Caleb. I'd like to turn it to Amruta, who has also led research on heat resilience in cities. And I'd love to hear from you. What lessons have you learned through that work, and what do you see as some of the major challenges?
Yeah, so echoing all of the other panelists, thank you so much for joining us for this really fascinating conversation. So I love hearing Caleb talk about the work that he does. I think it's very complementary with some of the research that I do. I'm not an MD, so I'm not in the clinic and I'm not treating patients, but at heart, I would consider myself to really be a data nerd. So I'm always looking for information and how we can use information to improve public health systems. So whereas, we might have information on an individual case-by-case basis, we can also look at things kind of in aggregate so that we can understand what are the impacts of these different stressors on health for different populations, who are the most vulnerable populations, and then also what are some of the programs that will be effective, and can we evaluate effectiveness at scale so that we can then start to translate some of these programs to other settings where they may not have an air conditioner program, or they may not have a green block program, or they may not have the misting tents. And I think one of the most effective ways that we can advocate for those types of interventions is by showing through the data and through the images of what's happening, the ways in which we're able to mitigate some of these adverse health risks. And so one of our projects, which up until recently was funded by the EPA, was looking at understanding cumulative climate and chemical stressors in the Mystic River watershed, which is a collection of over 20 different cities in the greater Boston area. And Flor has been working with us on the Acres project as the member of our steering committee for some years now. And I learn so many things every time we meet. But one of the things that we've learned is that the climate issues that people experience are regional, but the solutions may be very local. And so the solutions that are going to work in a place like the city of Boston may not work in the neighboring communities like the city of Chelsea. And so coming up with all of the different innovative solutions and then really engaging with the communities so that we can understand what are the things that will or maybe won't work for these community members, and particularly the folks who are most vulnerable, has been a really important part of the research process for us.
Thank you, Amruta. This next question can really be answered by all of you, I think. But if we could please start with some of our city leaders. When it comes to heat and the health effects of heat, what populations are you most concerned about and working to protect?
Sure, I can start. So in Chelsea, I think just knowing our demographic and also through various conversations with healthcare providers, broadly we've identified, I think, the populations that most of us already prioritize. Children under 5, pregnant individuals, people with disabilities, the elderly, or people with existing chronic conditions. However, I think there's definitely space for us to expand that list to look at outdoor workers. Chelsea specifically, over 80% of our residents identify as essential workers. So that means they're working in the restaurant sector. They're working outdoor, landscaping, construction. So I think that's a population that in Chelsea we are trying to figure out how do we include more communication to these sectors while at the same time recognizing, right, that our capacity is limited. And so I think we do face the challenge where in a small community, everyone pretty much is vulnerable. And working collectively, I think, to maximize our outreach.
I think to add on to that, there are some overlapping identities and factors there. So you had mentioned older adults, but I think it's also important to think about like older adults who may be more isolated, who don't live with family, and who may be homeowners. So there's no one necessarily connecting them like a landlord to regular check-ins, even if it's just to make sure that the bill is being paid. And often folks, especially in the Roxbury, Dorchester area with older homes that are not equipped for the weather that we're experiencing now and will be in the future. So I think there are definitely ways, as you had mentioned, to add a bit more of a specific lens, especially when we're talking about partnership with, for example, our Age Strong Commission. They do have programs and groups that they work with that focus on these specific demographics for other services, and so that's why that partnership piece is important.
Elaborate a bit about the Age Strong Commission, what that is?
Oh, sure. So the Age Strong Commission in Boston provides services for older adults. So anything from just getting out and being social to discounted taxi ride services and other services that essentially help to maintain high quality of life for our seniors. I think I lost my thought, so maybe.
Sorry, I question.
No, it was a good question. So maybe I pass it along. If it comes back to me, I'll let you know.
Well, I'll speak to kind of the other end of the age. You did a great job, Flor, of kind of the comprehensive list of population groups that we worry about. In Jacksonville, when we were doing our comprehensive resilience strategy, one of my favorite parts of that, when we did a ton of outreach with the community, key stakeholder groups, but we also did a survey with middle school and high school age students in Jacksonville. And across the board, the thing that worried them the most, that affected their day-to-day life the most, was heat. And so, they would talk about recess being hot, playing sports being really hot, and that, became a really clear indicator. And I think there were a number of steps in that planning process where flooding had been the primary focus, and very quickly heat rose to meet it. So those are really the two hazards that I think are top of mind for Jacksonville residents. But I loved having that young voice in that planning process. And then when we did a vulnerability assessment around heat, we learned that half of our county public schools are in the most high heat vulnerable footprint, and 60% of our after school care facilities, so the time where the time of the day when it's hottest, and when sports are happening and a lot of kids are outside. And so we're kind of tackling this in two ways. The mayor of Jacksonville created a chief health officer position, and he's been doing really direct outreach with the county public school system, making sure teachers and coaches are trained on the signs of heat exhaustion and know about taking regular breaks and how to make sure that these young people are kept safe as they're outside. And then my office has been doing a lot of work with our city's tree commission and working with the school system to start planting trees at these at schools that have kind of the highest vulnerable footprint, the lowest tree canopy. And we've also done some walkability studies. So students that are within 2 miles of their school are assigned to walking it, even if that walk shed is completely kind of barren and there's no shade in sight. And so we're also working with our public works department and our transportation authority to get as many trees as we can in those walk sheds, so that as young people are walking to school, they're benefiting from some cooling features. That's just a couple examples of the ways in which we're really trying to take care of young people and also be responsive to what we heard from them, which is that this is the hazard that affects their lives the most.
Amruta, please.
I really like the conversation around individual level risk factors. I want to maybe also bring in one of the things that we've been really concerned about, which is the people who have compounding exposures. So it's not just the heat, it might be the heat plus the fact that they rely on durable medical equipment, so they're really reliant on power. Or it might be that they live in a neighborhood where there's an urban heat island and there's also nearby chemical stressors or some sort of industrial facility. So we've been really concerned about the populations that maybe I'll call them intersectional exposures, intersectional climate-related exposures. And so in the presence of, both heat and a power outage, is it that the heat is the problem, or is it that the power outage is the problem, or is it really that there's just a nonlinear increase in your health risks because of exposure to both of these things at once? And I think that that also paves the way for thinking through some of these heat solutions. You mentioned the green space. Turns out that, depending on which type of green space or which type of trees you're planting, it also has important implications for flood barrier and flood mitigation. So it also opens up the opportunity for these kind of co-benefits, if you will, from the different solutions that are being implemented, which I think is a nice feature. And if you look at the health impacts of those different interventions, those are going to be very immediate. I mean, when we talk about the climate benefits of things like planting trees, it's going to take a long time for us to realize those gains. But the health benefits from increased shade or improved green space will be pretty immediate. So I think that's another benefit from that framework.
Thank you, Amruta. So I have one more question for our panelists, and then we have plenty of time for questions from the audience, so I'd love to hear from you. And this is about partnerships. Many of you have already touched on this already, but I'd love to hear more about your thoughts of what kinds of partnerships have worked really well, or what kinds of maybe unusual partnerships might be needed to effectively protect urban health from heat, and what kinds of partnerships might help accelerate the pipeline moving from research to policy.
I can speak a little bit to that. Hi. So I've had the huge privilege of working with groups outside academia on some of this. Over the past few years, we worked with AmeriCares and Climate Central, two nonprofit organizations, one in the humanitarian space, one in the climate data space. And in both cases, it's about finding complementary skill sets, right? This is ultimately a team activity, right? To run a successful program related to heat means having people who understand the physiology, the human behavior, the infrastructure, the long-term climate science, the short-term geography. There is a lot there, both in terms of technical skill sets that are involved and also setting strategic direction, because you can't do everything. And so you do have to triage out what is going to be the most appropriate intervention in this setting, who needs to be at the table for that conversation. For the trial that we're running in Boston, that meant working with Communities Responding to Extreme Weather, which is a nonprofit group focused on community-level adaptation to things like heat and severe storms, and also with the Family Van, which is a Harvard Medical School-based community health worker-run mobile health unit that is deeply in touch with some of these very at-risk individuals when it comes to things like heat exposure. And so setting up structures where people's voices can be heard from that range of organizations is a really important starting point. And I think as we were designing the study we're running right now, was really important to informing how we actually designed that and how we've implemented it.
I'll add two examples about partnerships. They're both very emergent, so ask me in a year how they're going. The extreme heat exercise that was done yesterday that Zoe and I participated in was a collection of cities kind of thinking through scenario planning, and one of the big takeaways for the team in Jacksonville was, let's do something like this, in Jacksonville with all of the players from our utility and our transit authority and the many hospitals that are in Jacksonville. Let's get some young voices in that and really start to map this out. That was, I think, in line with the level of stakeholder engagement we wanted to do for that FEMA grant, where we're looking at kind of different thresholds for emergency response. But I think really having a coordinated exercise is going to be really valuable. The other is an academic partnership. Flor, I feel like at the city level, sometimes academia likes to pitch things to us. And sometimes it's helpful, and other times, especially on tech, it can just be like splashy tech. So we've had actually a really fantastic team at the University of Florida that for about a year has been talking to me about building a digital twin for Jacksonville. And I always say, why? And then they come up with a whole bunch of examples of what we could do with this digital twin. And I sit with it and I go, well, that only works if you've got good GIS data that's going into this digital twin. That's not the 3D element. It's just 2D data all layered on top of each other. And so we've gone back to the drawing board a bunch of times, but one use case that we've come up with that I'm actually incredibly excited about is starting to look at the shade footprint, especially in downtown Jacksonville. And that is where having a three-dimensional model, we can start to see what is the shade ratio of our city over the course of the day. Jacksonville's downtown has a lot of development coming in. The shape of those buildings and the shadows that they're casting is going to have, a real significance on people's experience walking through our downtown. I think it's, we want that. We want this development to come in. We're looking at materials and cool roofs and things we can do to kind of minimize the impact that development has on the urban heat island effect. But frankly, that development's happening. There's going to be, a bit of an increase in that urban heat island. But if the human body walking down the sidewalk is in the shade, that's going to feel a lot better. And so I'm actually really excited for this academic partnership and to be able to have a way of very quickly judging, how potential developments and their design could impact the overall shade footprint in downtown Jacksonville. So I think that's one of those partnerships that took a lot of time to come up with a kind of a research project that I think is going to work for everyone and also utilize some really innovative technology.
I think I might have just found my next partnerships here, like Anne and Caleb. I don't think I can underscore the partnership with academia, speaking for, again, like a community like Chelsea, where we don't have in-house capacity to run sophisticated studies, analyze data, or even work with large data sets or create models. For us, knowing what the problem is, identifying the areas, we would not be able to do that without our academic partners. And I do agree and that sometimes academia does have an agenda and they do have an idea. I think we've been fortunate, and also in my work with Amruta, where is this sort of collective, really community-driven research approaches, where if we have a question, they have been more than happy to even consider modeling an answer or a solution. So I think that type of research is really what a lot of us in the local municipalities welcome and absolutely need to find really long-term solutions that are community-driven, that will be easily adaptable to the community needs. And also what Caleb said in terms of the partnership with the hospital systems and community-based organizations. My public health division is myself, a public health nurse, and a community health worker. There's no way that we can do any of this work without our partners. So I think they're crucial for the long-term adaptations and really just to keep our community safe.
So coming from the academia side, it's nice to hear that sometimes. No.
I think we've had really good experience.
Yeah, that's so. I was going to go back to maybe a little bit of a story. So, I'm relatively junior on faculty. I've been in my faculty position for about 4 years. And initially, we were doing all of these studies that were about cooling centers in the greater Boston area. Where are they located? How do we calculate access? I had a really fantastic doctoral student who was mapping, this is what it looks like to live within a 1 mile walking distance radius, and how do we calculate what walking distance is? And, is walkability, is that really the measure of access? And I remember being in a meeting with Flor, and she said something that just kind of entirely changed my perspective about cooling centers, because she said people in Chelsea don't necessarily want separate cooling centers. They want the places that they're already using to be cooler. Yeah. And I was like, that's mind-blowing to me. I never thought about that. I was thinking about, can we provide these centrally located cooling spaces and improve accessibility to them so that the most vulnerable folks have access to those cooling spaces? People may not want those cooling spaces. They may not work. And so I think that the partnership, the feature of the partnership is that, I may be able to help pull together the data and create the models, but without the input from the community partners and the community organizations, and we have this experience when we go out and we talk to communities around the Mystic River watershed, that's really how you get to know from the on-the-ground perspective, this is what's important. So I can do a lot of different research questions. I can make up an infinite number of research questions, but I want the research to be informing solutions that are going to improve public health. And I think the best way to do that is through these partnerships.
Yeah. I second all of the things that were mentioned. I think one of the things that comes to mind is on the pitch, right? On the academic pitch. I'll come back to that. We too often get pitches. What I would say is helpful is for those who are interested in pitching to tell us what it is that you don't see that we have. And if you can provide that, why do we need it? It might be a cool thing, but if we don't need it, or we don't know how to use it, or we don't know that we can use it, then we won't use it. But that doesn't mean that we don't want to partner with folks. So one of the ways that we are investing, particularly in startups and young startups, is through the Office of Emerging Technology. They have a track that is specific to climate tech. And so this is sort of our, they are developing a pathway for incubation for startups, young startups, so that we can test and implement new technologies in the city and then scale them. So that's one way. I keep losing my train of thought.
But you know what? We have 5 minutes, so it's a perfect
Amazing.
moment to open it up to the questions. All right. Wow. I see 1, 2, 3, 4, 5. I'll start with you in the back.
I'm Michael Liebman. I'm the Director of Energy and Resilience. Oh, sorry. Hi. I'm Michael Liebman. I'm the Director of Energy and Resilience at the Civil Society Institute. I work on solar plus storage microgrids. What we saw last summer, Hurricane Beryl hit Texas, caused power outages. We saw multiple deaths. From power outages in Texas, primarily older people living in mobile homes that died due to heat illness. So would be curious to hear, are you thinking about deploying solar plus storage microgrids as a solution to this challenge, kind of building on Amruta's point about let's bring cooling to where people already are, whether it's a school, a church, a business. And if you are thinking about solar plus storage microgrids, kind of what has your experience been so far? I know there's one in Chelsea, for example, Flor. Thank you.
So as you mentioned, Chelsea this year, I think we did install the first microgrid, and this was led by our Housing and Community Development Office in Chelsea, who are essentially in charge of the infrastructure changes. And this is, I think, a great question, because when we first started, I think, my work with Amruta as well, one of my major concerns was rolling blackouts and what would happen during rolling blackouts and a heat wave. Recognizing, again, close to 8% of Chelsea's population identifies with a disability. And in Chelsea, one of the challenges that we faced also during COVID was not really knowing where our homebound population lived or where we could find them or easily locate them. So I do think that having microgrids to really support the energy demand is definitely a solution, or something that the city of Chelsea considered, has implemented as a support to this bigger conversation around heat and sustaining, I think, our residents safe during heat events.
I'll just add really quick. I mean, I'm open and interested in it. Jacksonville's 850 square miles. So anytime we're doing something, we have to also think about the scale and the impact. And so microgrids have been really hard when you have 1 million population spread out over that large of an area. So that's one of the things that's kind of that's one of the reasons that hasn't been our primary focus.
And Chelsea is only 2.2 square miles. So that really, I think, exemplifies.
Yes, in the middle, please.
So I've already spoken to Anne about.
And introduce yourself, please.
Sorry, my name is Raj. I am CEO of Globe from Home. We're an experiential climate education company. And so we are always looking at best practices for heat and other disasters. So one question I had for Anne was about how they are implementing cooling centers. But coming back to Amruta and Flor, what was your experience of eventually the cooling centers that you said which you made? So what were the best practices or scalable solutions you found, both for cooling centers and also your cool roofs? How far did you get into cool roofs and how effective was it?
Okay, so as Amruta mentioned, cooling centers in Chelsea have not worked. We have, I think, for at least 2 years in a row, would set up schools as cooling centers, deploy staff, and maybe one family would come. And then, so that's a lot of resources, a lot of staff time that, as I mentioned, we don't really have in the public health division. And so our approach to mitigating that has been the AC lottery program. Over the last 3 years, we've distributed over 800 ACs in the city to residents. And one of our newest ideas is to work with our faith-based group, work with our community-based organizations, and work pretty much with larger already institutions in the city that we can then activate them as cooling centers, and they can serve as cooling centers for their own member base. And we still do have the senior center and the library as cooling centers, but as I mentioned, not a whole lot of people outside of those spaces are coming to those spaces. We still have not fully deployed our idea of bringing the rest of the community together. I think that's a plan that will probably start kicking off in February next year as we prepare for our summer response. But it is something that I think, as Amruta mentioned, some of the solutions may or may not work for some cities. I think Boston, you have cooling centers, and your experience may be totally different from Chelsea's.
I do think it's fairly similar. We have a number of cooling centers that staff say are not being used. That doesn't necessarily mean that people aren't going in, because our cooling centers are our community centers, which often host a lot of programming for youth. And you do have to sign up to access some of the programs and resources. So if you're going to use the computer room, oftentimes you need to sign up. But at the same time, in some other locations, we do hear, for example, in Chinatown, the community is advocating for more cooling spaces, and for us to augment the timing that they're open. So for folks who may be working in hot kitchens, when they get off of work, need to have a place to be cool before they go back to their homes, which are often quite warm, especially in Chinatown. So it sort of varies across communities.
We actually still have a few more minutes for questions. All right.
I would like just to rebound on this question. Thank you very much for all your diverse perspective. I come from Europe. I'm a professor of political science from Nantes, which used to be a green city of Europe, but I'm not here to lecture anything, because the US is often more reactive to risks than Europe. And this is something I had in mind. Two questions. Do you do emergency training or like a civil service at the municipal level? And my question is, do you only look at academics but people? There's a lot of common sense among people. What are your ways of soliciting that, among your immigrant communities? There's a lot of know-how, kind of traditional techniques to take yourself from the heat. So my trick is I put a wet, rag on my head, and it works better than anything else. And they use this in Africa. And in the bus, I could see an African, person who was doing this, and I was doing it as well. So you don't need to spend much or to go to great lengths to have great ideas. How do you solicit your people?
I can speak a little bit to that. Sorry, everyone. I'm originally from El Salvador, Central America. And I do recall, as a child, we always had umbrellas. Actually, the word for umbrellas for the Caribbeans is like stop water. For us in El Salvador is like provide shade. And so in Chelsea, it's predominantly a Latin American community. So we are trying to essentially remind people, we used to do this in El Salvador or in our home countries. It's okay for us to walk around with like an umbrella here and, to your point, have like a wet like towel over our necks to kind of help us stay cool. And people do that. But I appreciate, I think, the idea of bringing some of the lessons and tips that countries that experience a lot of heat that people utilize, because I think it's important to bring those and adapt them locally as well.
One last question.
Can I share the flip side of that? So in Florida, we run into a lot of people who say it's always been hot in Florida. And so I think one of the other challenges is that as heat is growing in severity, it may be over the span of somebody's life, not necessarily super noticeable, right? Like it's always hot, right? But the actual threshold of that temperature is getting hotter and the strain on the human body is worse. And so one of the things we have to deal with is people who are a little bit stubborn and think that because they could handle the heat 30 years ago, they'll be able to handle the heat today, not recognizing that their body has aged and that temperature is different. So I think it's a little bit of both we have to deal with.
Yes.
So, Jane Wiseman, my question dovetails beautifully to what Anne just said about messaging and convincing people. So we know statistically that people think other things are more deadly than heat, but heat kills more people than hurricanes and all that, right? Okay. Phoenix is on track to have a second year in a row of lower heat fatalities, but this year they also have a much higher rate of 911 calls for heat, which may or may not have anything to do with convincing people that heat is dangerous. So I'm curious, what other ideas do the panelists have for messaging that heat really is dangerous?
I can speak a little to this from a couple projects we've run out of Harvard Sea Change over the last couple of years. Both of these were with collaborators, Climate Central and Americares. So some of this is about teaching people to recognize something that's dangerous, right? I think if somebody here started having sort of one side of their face go limp and they started mumbling and their arm went limp, everyone in this room would probably call 911 and say, oh my God, they're having a stroke. That is messaging that has made it widely into the population. And we have built a healthcare system that is designed to rapidly respond to that in a stroke chain of survival. There are parts of this country, including the American Southwest, where we are starting to see a similar heat stroke chain of survival, where you have public messaging combined with EMS services that are trained to recognize, trained to cool in the field to get core body, which means rectal temperatures, which is something a lot of people were not initially comfortable doing. But that actually saves lives to diagnose heat stroke early in the field, get people cooled in the field, so that by the time they get to the hospital, that cooling process has already started, because minutes matter. So there is a heat stroke chain of survival that will, I think, reduce mortality and probably mean higher 911 calls. I'll be really interested to see the data that comes out of that part of the world over the next couple of years. When we think about places like Boston or other temperate zone cities where this is not a 100 days a year issue, this is maybe a 10 days a year issue that will be 40 days in 10 years. This is a lot harder because you're not going to have the same number of reps for a lot of the clinicians, and the relative importance of this may not feel as big compared to all these other competing priorities that organizations and people have to deal with. So I think there's a lot we can do in terms of public education and clinician education to build those chains of survival. But we cannot lose track of the preventative approach we've been talking about, because if everyone is developing these symptoms, that's still an enormous strain on the system.
Okay. Well, I'd like to thank our 5 incredible panelists for this really enlightening discussion. So I feel heartened by the opportunities that were discussed and the solutions that were discussed and the number of things that we can do to address heat in cities. And thank you all so much for coming and for your